Hello Brain Shakers, Brave Alistair is here from the Brain Shakers Academy. Now I did a video on the menstrual cycle and I received a number of questions on what causes painful menses or menstrual cramps, and basically the medical terminology we use is dysmenorrhea to indicate that one has a painful menses. Now what basically is dysmenorrhea, or what are painful menses? So you could either be having what is referred to as primary dysmenorrhea or secondary dysmenorrhea. Now, primary dysmenorrhea is just basically you having menstrual cramps or painful menses without any underlying cause, or where the cause is basically not known. Then secondary dysmenorrhea is where there is an underlying cause, such as a pelvic inflammatory disease, which is just an infection of your pelvic organs, or it could be, in most cases, another condition that we refer to as endometriosis. Now, endometriosis is just where there's growth of an extra form of tissue. It could be around the uterus, it could be around your fallopian tubes or the ovaries themselves, or around the pelvic organs. And now what normally happens is that with that extra tissue that is there, it tends to inflame and then form scars. And as it forms scars, sometimes it may even bring the pelvic organs together and form what we call adhesions. Now, with the cramps themselves, what normally happens is it is as a result of your uterus contracting and trying to shed off its lining. Now, just building on from one of the videos that I have done on the cycle itself, the menstruation period comes in when there is a drop in your progesterone and estrogen levels. So once there's that drop, it means that the lining of your uterus now has no feeding. So there's no supply of that progesterone and estrogen because it has gone into lower amounts. So it's not feeding and it has to be gotten rid of. So it is that contraction effect of the uterus now to get rid of the lining of your uterus that is going to cause that pain. So that contraction is going to increase what we call the intrauterine pressure, and when there is a rise in the pressure there, it means that there's a decline in the amount of blood that is coming to the uterus, thereby reducing the amount of oxygen as well in the uterus. And so it is a state of ischemia and a state of hypoxia that the uterus actually undergoes, coupled with the hormonal chemical elements that are produced for the lining to actually shed, which we call prostaglandins. Now, these prostaglandins are what makes your uterus contract. So the intensity and severity of the menses or the painful menses is going to be as a result of how much of those elements you are producing, the chemical elements which we call prostaglandins. So if you're producing only a tiny amount, then you have somewhat menstrual cramps that could be handled, or something that you could actually bear without even having to take any remedies. But if you're producing a high amount of those prostaglandins, then it means that you may end up having more painful menses. And so you notice that for some people, there's no one cast and concrete time for the cramps to actually start. But for most people, the cramps will start a day or two prior to their menses. For some, it will actually start once their menses have already started. And you tend to notice that the cramps will increase when the flow also reaches a peak. That could be on day 2 or day 3 for those that slightly have a slightly longer period of a cycle as well. But they tend to actually reduce in amount once your flow has reduced. But for some people, it may even continue even after they've had their menses and all their menses are all complete. Now, there's obviously things that you can use to kind of help you in relieving the painful menses. And number one, or the first recommendation, obviously, if you're always in agony with these menses, we tend to recommend what we call non-steroidal or anti-inflammatory drugs such as ibuprofen, naproxen. Those drugs, actually what they do is just cut the pathway for your body not to produce high amounts of the chemical element, which is the prostaglandins themselves. And then the second option would be to use contraceptive methods that contain the hormones. And remember, we said that it is the reduction in the hormones that then cause the production of that chemical element, which is a prostaglandin. So once you take those hormonal elements, which is containing the hormones, then it means that you'll be keeping the progesterone and estrogen levels to a certain amount, thereby reducing the amount of prostaglandins that you are producing, because it is the amount of that chemical element that you produce that then determines the intensity as well of your cramps as well. You could use other non-pharmacological things such as a TENS machine, which has just pads, and then you can put it on your back as well. Or it's a non-invasive kind of a pain relief that will just basically block the nerves from transmitting your pain signals from your lower back, because once you have that painful cramp, oftentimes it stretches to the back, like a throbbing pain as well to the back. So you could use a TENS machine, you could use a hot water bottle. Others tend to put those to kind of help in relieving the pain, and exercising a little bit more regularly, because we know that exercises improves your circulation, and so improve the circulation to the uterus as well, and also improving the oxygen levels. And those are some of the things that would basically be helpful. But find out what works well for you, and if you notice that it's something that is unbearable, then visit a health practitioner and be seen, and they may try to run a few investigations just to rule out certain other things that may then be causing you to be having all those painful menses. I hope that's a little bit helpful in understanding basically what causes painful menses. If you do have questions, please leave me questions in the comments section as well, and don't forget to give me thumbs up. And if you really want to see videos such as this one, don't forget to also subscribe to my YouTube channel, which is Brain Shakers Academy. And as always, it's a pleasure. Thank you so much for watching, and I will see you in the next one.